I research into health inequalities and how they vary by place and between different groups of people, and based on a famous quote from Bill Shankly when he said that football was more than a matter of life and death, I felt that using football teams might be a useful way of highlighting health inequalities in our country. I use data from Public Health England, where they collect data about things like death rates and how many people in an area smoke and things like that, and they collect them by local authority. So I linked each local authority to the relevant football club. I then ranked all the football clubs in terms of their health outcomes to get this league table. And I think the league table shows some quite stark results in terms of health, particularly in terms of the north-south divide, with only one of the northern clubs making it into the top half of the table. A lot of the football clubs are actually based in some of the poorest parts of our inner cities, and obviously that relates to their historical development within working class communities. And health in poorer areas is much worse than it is in richer areas, and that's really shown in the table in the sense that Chelsea, represented by data from the Royal Borough of Kensington and Chelsea, wins the Football League, and that's because it's a more affluent part of the country, and the areas that are poorer tend to have worse health outcomes. I used a number of important public health outcomes, things like percentage of the population in the areas that have obesity or overweight, smoking, alcohol-related hospital admissions, death rates, male and female life expectancy, and also the health inequalities within that particular area. Another interesting example is the Newcastle-Sunderland derby, where Newcastle would win, and that's because alcohol-related hospital admissions are slightly lower within Newcastle than they are in Sunderland. However, it's also important to say that all but the top 4 of the football teams that we've ranked here would be doing worse than the national average on at least one of these major health outcomes. Well, I was involved in a report called Due North that was published last year. That was commissioned by Public Health England, which is a government agency, and in that we analysed evidence about what could be done, and we concluded that what was most important was improving the economic conditions of people in our inner city areas, and that includes things like having a living wage, ensuring that welfare benefits actually lift people out of poverty and things like that. These are really important, and obviously particularly important as the new government considers its agenda.